Go ahead and get started. Thank you everyone for joining us. I'm Gregory Phillips with 𝐓𝐡𝐞 Communications. Welcome to the latest 𝐓𝐡𝐞 media briefing on the COVID-19 pandemic. We are recording this briefing and that recording will be available to everyone who registered. 3,121 people died from COVID-19 yesterday in the US. That's the first time the country has recorded more than 3,000 deaths from the virus in a single day. Despite public health guidance, there is still entrenched resistance to wearing masks, limiting social interaction and cancelling holiday gatherings. And widespread reluctance to vaccinate could also extend the pandemic. We have three experts in psychology, behavior, and vaccine hesitancy with us today to discuss how to break through attitudes that have solidified around a year of COVID misinformation. With us today is Dan Ariely. He is a professor of psychology and behavioral economics at Duke and a founder of the Center for Advanced Hindsight. He studies the irrational ways people behave and designs methods to address them. Good morning to you.
Good morning. And I think next time, please pause after you say the Center for Advanced Hindsight. I think people just need to stop and reflect on how wonderful this name is.
Sure, absolutely. I'll bear that in mind. Thank you. Also with us is Gary Bennett. He is a professor of psychology and neuroscience, global health and medicine at Duke. He directs the Duke Global Health Digital Science Center and is also president of the Society of Behavioral Medicine. Good morning to you.
Good morning.
And we have 𝐓𝐴𝐥𝐿𝐵𝐵𝐵𝐵𝐵𝐵𝐵. She is an assistant professor in the Department of Family Medicine and Community Health and the Global Health Institute at Duke. She studies vaccine hesitancy and how to address concerns that people have about getting vaccinated. Good morning to you.
Good morning, Greg.
Okay, so we'll go ahead and get started. Professor Ariely, I'd like to start with you. After almost a year of deepening divides on this, what, if anything, can be done differently to reach people who aren't following public health recommendations to slow the spread of the virus?
Okay, so first of all, we have to recognize the fact that doing something now after a really, really long time of not doing a lot is not easy. We have to work against a lot of forces. And I think the first thing we need to do is we need to put a time separation between the past and between the future. There's lots of negative trends in life, and there's not upward trends. Downward trends are much easier. And if we want an upward trend, what we need to do is to stop, reflect, and then start fresh. Think about something like the Day of Atonement or the Catholic Confession. So we need to create a new contract. That's the first thing. The second thing is that if you think about people's experience, personal experience, it would basically teach us that it's not a good idea to follow the guidelines. And here is why. Think about something like texting and driving. Imagine you think to yourself that the probability of texting and driving and something bad happen is 1%. So one day you drive and you're tempted by your phone and you text and nothing happened. The probability is 1%. But what you do at the end of this is you update your belief. And you say, maybe it's not 1%, maybe it's 0.75%. And then you're more likely to do it, more likely to do it. COVID-19 is the same thing. It's a terrible tragedy. But on an individual level, if you one day walk without a mask or you're not careful and nothing bad happens to you, you learn the wrong lesson. And then you learn it again and again and again until, of course, it is too late. And if you think about it this way, it's about a low probability event. It means we need very different tools. We can't hope that people's personal experience would teach them that this is a good idea. That's just not going to happen. What we need instead is social understanding that this is the right behavior. We need people to say to each other, thank you for wearing a mask. And we need people to say to each other, I'm sorry, I don't feel comfortable. Would you mind putting a mask on? It has to be friendly enforcement of everything we do about the act of not wearing a mask and not about the fear of catching it. So these are kind of two of the things that we need to start doing.
Sure, absolutely. And I'd certainly like to come back to that. For now, I'd like to move on to you, Professor Bennett. We know that a lot of this behavior modification suggestion has to come from businesses and governments, and they're asking people to adopt the same behaviors, social distancing, wearing masks, monitoring symptoms, and so on. But there is this subset of the population that continues to push back. What tips can you suggest for how organizations can get through to people who still need to make these changes?
Yeah, well, I think let me start by suggesting a few things that I think won't work. The first is browbeating people. So we've seen some really horrid examples of messages from leaders to members of organizations, to student groups, to individuals and communities, really browbeating for not adhering to recommendations. We know that kind of approach is generally not a very useful one. It's also not useful, I think, to imagine that all of the kinds of change that we're trying to promote is within the control of the individuals that we're trying to influence. That is to say that organizations, leaders have a role to put together policies, system structures that will make it easier for individuals to adhere to our recommendations. And the third thing is that there is a widespread perception that education is a cure-all for situations like this, that if we just told people more about the condition, if we just helped them to understand how significant of an event this was, then they would change. And I think Dan rightly pointed to a lot of reasons why that kind of notion doesn't work, but it actually doesn't work for most health conditions and most public health calamities like this one. So what I think instead we want to do is to do a lot less telling people what to do and to show them examples of how they can do it. That starts with leaders in organizations. It's really critical that they model the kinds of recommendations that they are making. It's important that we have a strong policy, programmatic and kind of systems architecture that's there to support folks in organizations. So if you're a business leader, then having your hand washing stations and having your sanitizing stations, having a testing protocol, which can be an important reminder about the nature of the pandemic, those are all really critical components. I'd argue that we also have to have empathy for the complexity of these moments. What people are showing up with at work is a very, very small portion of how they are embodying this kind of scenario. And it's important for leaders to continually acknowledge the kind of the efforts that people are taking. And most important are creating social norms that align with the kinds of behaviors that we're trying to promote. That is what we aspire to, is a world in which everyone feels like they are doing the right thing by following the guidelines. And if they're out of step, they recognize it when they see everyone else doing the right thing. And that's about having really clear goals, being very consistent with them, reinforcing your recommendations on a regular basis, and again, being really, really careful to encourage people and not to browbeat them when they have not adhered.
Yeah, I want to add to what Gary is saying about this importance of social norms. Think about somebody who wakes up one day with fever and a cough, and now ask yourself, what would this person do? This person is already sick, let's say. Now, if you're sick yourself and you don't care about other people, then what you should do is you should say, let me go out and keep on my own business. If you're a low-income individual and you have a daily wage, you certainly have lots of pressures to go and work. And what you realize is that things like COVID-19 is a public goods problem. If I just think about myself, I would act very differently. But if I think about my role in contributing to the public good, then I would act very, very differently. And this is why social norms are so important. Because if we just think about ourselves, we would act very differently. But if people basically both reinforce us in a positive and a negative way, thank you for wearing a mask. Excuse me, would you mind doing it? It's something in the environment, we would act very differently.
Sure, thank you very much. Of course, the other aspect to this is we've had promising vaccine trials and vaccines are getting ready to roll out, but it's very important that people actually get vaccinated. Professor 𝐓𝐡𝐞, I'd like to move on to you. We know from history that seasonal flu vaccination rates tend to hover at about 50% each year. But how important to controlling the pandemic is it that we have higher vaccination rates than that for COVID, and how can we get there?
Yeah, in my opinion, our best hope of getting the pandemic under control, given everything that we've seen, is to get high rates of vaccinations with the COVID-19 vaccines. Now, vaccines are not going to be our only way out of this pandemic, but I definitely believe that they will be a very important, if not the most important component of our strategy to end COVID-19. I absolutely agree with what Professor Ariely and Professor Bennett have said in terms of this being something that should appear as a social norm. And public health is all about collective action, right? There is no public in public health without public participation. But given my experience studying vaccine hesitancy, it is still a question in my mind whether we can achieve high rates of vaccinations. The last numbers that I saw after Pfizer made its announcement about the vaccine was that 58% of Americans would be willing to accept the vaccine. And that's as opposed to 50% before the announcement was made. This 8% bump is encouraging, but current estimates suggest that we need to get closer to the 70% mark. And having effective vaccines like the ones that we have right now is critical in this equation. But the thing to remember ultimately is that vaccines themselves don't save lives, vaccinations do. And if you remember, as an example, measles vaccine, the MMR vaccine is one of the most effective vaccines we have currently, and 2 doses of the MMR vaccine actually provide 97% protection against measles. But if you look at the situation we had in 2019, WHO just reported that there were over 200,000 deaths due to measles in 2019 alone. And that number should come as a shock to everyone because we are so focused on similar numbers right now with the COVID-19 pandemic. So I think there is a lesson to be learned from the measles epidemics that we saw last year. And now that we have effective vaccines for COVID-19, we need to focus all our efforts on doing everything we can to get people vaccinated. And my hope is that as the vaccination campaigns unfold in the UK, Canada, and here in the US, we will see the vaccine acceptance rates go up. And really, there's no excuse for losing any more lives to this horrific pandemic once we have an approved vaccine.
Sure, absolutely. Thank you. Thank you to all of our panelists for those opening answers. We're going to open it up to questions now. Thank you to those reporters who already sent questions. Zoom users can type a question into the Q&A window or raise your hand in Zoom. If you're calling in by phone, you can raise your hand by pressing *9 and we can unmute you so you can ask your question. To start off, we do have some previously submitted questions, and Professor Vasundevan, I'm going to stay with you for a moment because first question we had came in was asking about what kind of PR campaigns are the most successful. What are the essential elements of a campaign that will convince people to get vaccinated?
Yeah, that's a great question. And as you know, my research focuses on childhood and adolescent vaccines. And I've done a lot of work trying to understand how people make decisions about vaccines. And I think there's a lot to be learned on how that applies to the COVID-19 vaccine hesitancy space. If I can boil everything down, I think the 2 things that come up are the need for information and the need for trust. But as we heard Professor Bennett say earlier, information alone is not enough. It is important. It is important that the information has certain characteristics. We have evidence to show that the more personalized the information is, the more it answers the questions that people have, as opposed to being generic, saying things like vaccines are safe, vaccines are effective. You know, those kinds of messages really fall flat for many people who have hesitancy because they have very specific questions. So the nature of the information is really important. The second thing is who is providing that information. Now, if you just have information, it's coming from a source that you don't know or trust, again, that information is not going to go very far. But if you have somebody who trusts, whom you trust, but is giving you incorrect information, that's what's going to be absorbed. So I think both pieces, information and trust, are very important to consider in any PR campaign. And really, given the ways in which people consume information these days, any PR campaign has to, deliver information across multiple media channels. So we're talking about social media, we're talking about web-based information, but I think there's also a role for dialogue-based interventions. There's a lot of evidence for that. So actually having trusted individuals deliver information. And I'm talking about community champions, health providers, and individuals that the person that a person trusts might be different, right? So it's identifying people who can convey that information in a way that's trusted is important.
If I can add something to this issue, like if I could design a system that would increase vaccination, one of the things I would do is I would change the defaults. And what do I mean by that? Right now, when you wake up in the morning, the default is that you'll not be vaccinated. You have to do something to get vaccinated. And we know that this action creates a bias against doing it. People basically don't like to do things that are outside of our standard. And we also feel more regret if we do that. So instead, what I would love to do is I would love to schedule for each citizen an appointment for vaccination. Now, I would still allow people to opt out. But instead of saying, I want in, people would have to say, I have an appointment, it's Wednesday at 2 p.m. And now if I want to, I can opt out for that. And that's a shift in the chain, in the way of thinking about this. Because right now I would say, do I really want to put the effort into doing this? When it's the other way around, I think that more people would get vaccinated. So going back to what Gary was saying in the beginning, the systems that we create are incredibly important. Are the systems supporting it? Is it the easiest thing to do to get vaccinated? By the way, with vaccines, if you have it easy access and so on, makes a big difference. So here too, I think we need to say, how do we make it public? How do we make it visible? How do we make it the default? And then on top of that, there was a beautiful campaign that basically framed vaccination not as something that you do for yourself, but as something that you do for other people. Your grandparents, for example, you don't want to be a carrier that infects your grandparents. I think we need to do all of those.
Yeah, I'll say briefly that I think too that the vaccine hesitancy is going to be the risk factor, a primary risk factor for deaths from COVID in the next year. And so this for me is one of the most important public health challenges of our time. The only thing I'd add is that I think the kinds of public service campaigns of old that some of us grew up watching are no longer going to have the kind of utility that perhaps they once did. We don't need a public service campaign. We probably need thousands, hundreds of thousands. The kind of precision targeted environment in which we now live, where all of our experiences are highly curated for us, actually provides some advantages in this kind of for this kind of scenario. But what I'd point to here is that for me, the sort of mistrust is just a primary challenge that we're going to be dealing with in this vaccine hesitancy circumstance. And the reasons for mistrust vary considerably across the population. And they vary. They happen to be particularly high in the groups that have the highest rates of COVID and death from COVID, and high and variable. And so I think it would be a mistake for us to imagine a kind of one-size-fits-all public service campaign as a solution here. It's going to take a much more nuanced strategy. And I completely agree with Dan. Changing the defaults could be a really powerful part of this solution.
Sure. Thank you all very much for that. And Dan, I would like to come back to you on this issue that Dr. Bennett just raised about trust. So we need to rebuild trust in government. Obviously, for the first year of this pandemic, we had a president who was contradicting his own public health messaging. Now we have the opportunity for a new start. And I wanted to ask you about this first, because at the beginning, you talked about this need for a new start, and there's an opportunity to say, okay, this is a fresh page. Is that messaging that you think can come from an incoming president? And how can we rebuild trust in government so that the messaging that's coming from the government about vaccination and other things will actually get through?
Yeah. So first of all, we talked a lot about the fact that it's a public goods problem, right? That we all need to contribute to fighting COVID-19. Like, think about taxes. If 10% of the people don't pay taxes, we have 10% less taxes. But if 10% of the people don't adhere to Corona, we all lose. And we're all waiting for this vaccination. It's kind of amazing to say we did not have the willpower to wear masks, keep social distancing, and wash our hands for a month. Like, if we did it in a consistent way, things would have been very, very different. Now, thankfully, a vaccination is coming, but it's also terrible admitting of our own failures as human beings, that we were not able to defeat it. We know what we need to do, right? It's not that difficult if you say, let's just do it for a month. We were unable to do it, so now we're waiting for an external intervention to help us. But trust is one of those things that allow us to collaborate. Why? You see, if I think that other people are not going to adhere to the COVID rules, I don't have a reason to do it as well. It's only if everybody does it, then we all have the benefit for doing it. So it's a collective action kind of a problem. If I thought that only 20% of the people would take the vaccination, there's no point in taking the vaccination as a public goods problem. So we need to figure out that we need to work together, and we're all going to do it together. And I think a new president can get us to start a new contract with the government, right? Basically saying, let's start fresh from now, and here are the rules. Now that president would also have to tell us what are the trust ramifications on their side, right? So to say something like, I will communicate when things go well and when things don't go well, and basically saying that there will be a systematic view to trust somebody. So I think we can have a starting day, we can have a new contract, but it can't be an empty promise. It needs to be something with some power behind it. For example, you could say, if we're going to do it, we're going to all try to do it over 100 days. And here is how we're going to support communities who do well. And here is how we're going to put extra effort on the people who need the extra help. And basically saying what is going to be the give and take with the government. And then, so that's on the social contract side. I also think we need better explanation for what the science is. Some people are afraid. A lot of it is from bad use of media. People are afraid of injections and what is this material that comes in, and there's all kinds of conspiracy theories around. And I think we need to calm people down. And usually we say, oh, it's nonsense, just trust us. Well, maybe that's not the right approach. Maybe we need to take this fear seriously with respect and explain what is an RNA-based vaccination. What does it look like? How does it work? What is the mechanism? Now, we can't do a PhD in biology, but maybe we need to work a little bit on helping people understand what this is all about and how it's going to work with their bodies and why they don't need to be afraid.
Sure, thank you. And Professor Bennett, to build on that, you mentioned earlier about empathy, and it's no good to browbeat people. We need to have empathy. How do you think that can work from a leadership perspective? Do you think it's important for a president or a leader of an organization to talk directly to people? It's like, I understand why you don't want to wear masks. I understand why you don't want to social distance, but this is why it's important. How can that empathy work from a leadership perspective, do you think?
Oh, I think it's critically important. An essential human need is to be seen and heard and understood. And when leaders demonstrate that with their words, I think it is an important building block in establishing trust. I think the challenge for leaders at this time is being vulnerable enough and wise enough to do the hard work of really understanding some of the reasons for the mistrust and how they may vary in different groups. And so, my recommendation to policymakers at moments like these is to really spend some time listening intently to various constituencies before you say back how much you understand what folks are going through. When I spend time in other parts of the state, various parts of the state, I hear articulated among folks who don't favor wearing masks, a pretty clear kind of core value about being autonomous and not being imposed upon by the government, and an interest in economic productivity and development and caretaking for families in ways that don't involve kowtowing to the government. Right? There are these kinds of messages that I think are strongly held, and I think require very deft politicians to sort of understand and to provide some feedback for. I'm struck that one of the things I think we've learned in the last maybe 5 to 10 years has been that if 40 years ago we looked to political leaders as our primary leaders in American society, I think that list is much more variable today. And I think politicians have an important role to play, but I think our corporate leaders have shown, particularly with some of the social unrest in the past 9 months, that when they stand up, that they also have an important role to play in processes like these. I think the leaders of some of our pharma companies, it's really important for them to be available at moments like this. Civic leaders, religious leaders, all around the country. Religious leaders want to have people back in their houses of worship. I mean, there are important, I think, important sort of multi-sectoral partnerships that could be played to demonstrate the kind of empathetic leadership we need to move forward.
Sure, absolutely. And I guess as Professor, sorry, go ahead, Dan.
One of my favorite all-time politicians is Antiochus Mockus. He was the mayor of Bogota, and he did lots of wonderful things. But there was a time when there was a drought in Bogota, and what he did was he showed people how to shower. And the idea is, nobody, I mean, maybe when we're young, people teach us how to shower, but then they don't teach us how to shower, how to save water. And he basically went on public television and he showered in public. He said, here's how you turn the water on, you get wet. By the way, he showered with his wife. So he said, here's how you turn the water on, you get wet, you soap yourself, you soap your significant, you turn the water off, you soap yourself, you soap your significant other. If you're having images of our current president doing that, don't. But if you think about this notion, he gave a concrete example for imitation about how you act with the goal of saving water, and people followed him. People took, here's a sign, here's how we do it, here are the details. And when Gary is talking about leaders, if people say one thing and do something else, it's very confusing. And what we need is not just people to tell us what to do, but to show us how they do it. So for example, mask and social distance is not easy to figure out. How do you do social distancing when, I don't know, when the family is there? And can we get help by seeing people who are doing it the right way? Vaccination, a little easier, but still, we need to see examples of people doing it and examples of the little details of how it works into their lives. And then I think there'll be higher compliance.
Gotcha. Thank you very much. We're going to move on now. We've got a raised hand in the chat. Carmen Pound, I hope I've pronounced your name correctly. You're unmuted, so please go ahead and ask your question.
Yes, thank you so much, and thank you for doing this. Is very interesting. I have many questions, but I'll try to limit them down to a few. I wanted to ask the three experts if they have any examples of countries or communities anywhere in the world that have managed to turn things around. Like, they didn't have people, the people didn't want to wear masks, and then there was some sort of like intervention that got more people to wear masks or social distance. And are there any innovative ways that so far those kind of, norms have been communicated? I don't know. I know in other cases, for example, when it came to HIV in the past, in some countries, soap operas were used to kind of like, show people the risk and how to take care of themselves. Have you seen any sort of those examples in this pandemic anywhere in the world? Thank you.
So first of all, there have been a lot of things that have been done well. I think there were lots of social media campaigns on wearing masks and explaining how you do it and the efficacy of that. I think basically the traffic light approach that has been used in many countries to say, rather than looking at the whole country as one, they've divided into small cities or neighborhoods and say, you're responsible for your safety. And if the numbers in this area go down, we'll release some of the economic limitations and some of the limitations on movement. That has been very effective. Why? Because it's hard for us to care about the whole country. But the moment you limit it to a small community, imagine it was just your neighborhood. If it was your neighborhood that was either green, yellow, or red, everybody around you would care a lot about how to do it. So the traffic light approach was very effective. The approach of conditioning good behavior on using public services like transportation, public transportation in China was very effective. So there's lots of different elements that were very effective. And of course, the biggest predictor of adherence has been trust in governments. If you look at the countries that have high trust in their government, behavior was just much, much better. And the reality is that every day that we adhere to COVID rules, we have to give up something. We have to see less of our friends. We have to wash our hands more. We have to be uncomfortable with the mask. Whatever it is, do we trust that the instructions are indeed correct and that they're really for the public good? So I think nowhere in the recent history was trust so important. And the countries that do well have done well on that as well.
Professor Bennett, if you have anything to weigh in on here, I'm curious as well, and Professor Ariely touched on this, is that things that work in other countries, because America has its own individualistic kind of culture, how messages from other countries can break through in this kind of an environment.
I think you're absolutely right. I mean, I can think of many examples of campaigns and public health programs that went very well. In South Korea, Singapore, China. There are a variety of examples of places where the pandemic was contained. There are a few examples that are not that are in cultures like ours that do tend to have this more individualistic and sort of dispositionally less trustful kind of ethos, and it's a particular challenge for us. I'd say that just back to Dan's point about sort of showing what to do as opposed to saying what to do. We do have lots of examples in sort of recent American memory of public health campaigns that help to demystify, destigmatize, and decomplexify kinds of interventions. One that most of us remember is actually what's they now call the Katie Couric effect, where Katie Couric underwent a colonoscopy on live TV, and we've seen lots of subsequent examples of that by media figures who've taken on gone through these kinds of procedures that were formerly kind of stigmatized and that we had sort of suboptimal rates of adherence to, and you see really pretty significant changes as on the back side of that. I'll point to something that's a little bit more local for us, and that is something that we did here at Duke this fall with our student community. My colleague Mary Pat McMahon, who leads our student affairs team, put together what we call a C team, which means many things, but effectively what it involved was having a roving band of individuals who circulated around the campus and rewarded students for doing the right thing. So if we saw them wearing their masks, they might have gotten a little card for free coffee. If we saw them socially distancing, we gave them a card for free food or something like that kind of thing. And sometimes it was just a pat on the back. And that reinforcement for doing the right thing is what builds the kind of social norms in a community. Again, something that's possible on a very kind of a hyperlocal level, but builds the kind of social norms that then act to try to promote sort of adherent behavior when you're not doing those kinds of reinforcement kinds of activities.
Sure, absolutely.
This might be a good time to mention that I think all of us are very proud of being at Duke for how Duke has managed COVID, and partially it's Gary's and his influence, but there was a social contract. And there is a continuous message that we are a community and we have an obligation for each other. And if you walk around campus and you look how the students behave and look, they do look for each other and they do give each other positive and negative feedback. And they do ask when they see their professor getting a little too close, they do it. And, we've been, I think, very impressive approach. I have to say, I'm very proud of it because it's a combination of the leadership taking it seriously. It's a combination of the leadership understanding social science, right? It's not just a health problem, it's a social science problem. It's a real measurement of the community caring enough. It's really, I have to say, it's like warms my heart to see how successful we are because it's such a wonderful collective effort.
Sure, and certainly collective effort is at the heart of this. To get back to the question, Professor Vasudhavan, I'm wondering if you could talk about, having studied vaccine hesitancy around the world, do campaigns for the US have to be different than other countries? Are there things that work spectacularly well elsewhere that have to be tailored to the US for this individualistic culture that we have here?
I think most of the tailoring that we are talking about is pretty much the same, irrespective of where you go in the world. I think we have the added challenge, as the other experts mentioned, of being in a highly partisan environment. But I would argue that that's not unique to the US. We see that in other parts of the world as well. I think in terms of what we need to communicate, this tailoring, personalization is extremely important. And that keeps coming up every time we talk to people about how they make vaccination decisions. And I think just thinking about the kinds of questions that people have at this time about COVID-19 and the COVID-19 vaccine, the first and foremost thing to address would be why someone should actually consider getting vaccinated. Because we have to admit that along with the COVID-19 pandemic, we are seeing this huge wave of denial. So even though, as you mentioned, there were 3,000 deaths yesterday, there are still people out there saying that there is no COVID-19. So I think just talking about the fact that there is this disease, conveying the importance of vaccination itself is going to be a huge challenge in some places. The second thing would be to talk about whether the vaccine works. So, what is the effectiveness of the vaccines? And there have been questions about not just, does it work in the short term to prevent the disease? Do we have enough information to say that the vaccine is going to prevent COVID-19 in the long term? Are we going to need vaccinations every year? What's the effectiveness? And I would say we don't have a lot of information there, especially about the long-term effects. And this is one of the issues we've had in this COVID-19 pandemic in general, because, you know, if you think about December last year, we were all blissfully unaware of anything called COVID-19, and we were busy going to coffee shops and going to our jobs. Like, there was no problem. But here we are a year later, and I have to say, we have made tremendous scientific progress, given that we knew nothing a year ago, pretty much, or most of the general public did not. But there are still gaps in information. And what happens when you have gaps is those gaps get filled in by things other than science. So you have misinformation, myths. And as Dr. Ariely mentioned earlier, when you have something in place, it's harder to dislodge that and replace that with science and facts. So I think we need to make sure we have some information that we can communicate on vaccine effectiveness, what we might expect to see long-term, maybe based on what we've seen with other similar vaccine candidates. The third thing would be about who gets the vaccine or who can get the vaccine. Now, we know that not everybody has participated in trials, so there are obviously questions about, you know, how do we know it's safe in older adults? We don't have any data for children. Do we know if it's safe in pregnancy? So all those questions need to be answered. And that leads to the next question, which is broadly about vaccine safety. And I think that's where we get into this question about, you know, is the vaccine safe for people like me? And by me, I could be referring to somebody of my race or ethnicity or my health profile. And we are hearing a lot of those concerns, especially among Black Americans. So the rate of vaccine acceptance in that particular community is less than 20%. And I think there's a lot of concerns that vaccines have not been tested in a racially and ethnically diverse populations, although that's not the case. But it's important that we communicate that information and make sure that any future trials incorporate a diverse population that will give people confidence. And we can also provide that data in any communication. And the last thing, as Dr. Ariely mentioned earlier, was really talking about where do I go to access vaccines, right? Where to go, how much will it cost? In this case, of course, COVID-19 vaccines are being provided for free, but if you have scheduled appointments already, that reduces access barriers, right? Like, you don't have to go through the task of scheduling, picking up the phone, calling somebody, being on hold, figuring out things on your calendar. We all know how cumbersome that can be. So it takes away a lot of resistance or complacency in getting vaccinated.
I want to add two things to this. One is that I think we should use this scarcity as a way to create motivation. So I'm imagining that we have a wait list and we let everybody sign up and wait. And, you know, even if 58% of the people sign up, there'll be a long wait list. It will look like everybody wants this, right? Sometimes startups do this, like how many people are registering for this thing? I think we can get a lot of action by showing the interest, right? Rather than showing the lack of interest, basically doing that. But the other thing that this discussion makes me think about is something called solution aversion. And the study I'll describe to you was done on people who deny global warming. So imagine that you take a group of people who are denying global warming, and you break them into three components. And one of them, you say, how big is the problem of global warming? And they say, not big. You take a second group, the same people, and you say to them, the solution to global warming is more government intervention, more regulation, more rules, more taxes, and so on. How big is the problem of global warming? And they said, not a problem. And then you take the third group and you say, the solution to global warming is less government intervention, less taxes, more freedom for companies to find out their own thing. How big is the problem of global warming? And they say, it's a big problem. And the insight from that study was that some of the people who deny global warming don't deny the facts. They basically deny the problem because they don't like the solution. It's as if I would come to you and say, you have a terrible disease, you can't eat chocolate for life. And you would say, what? I probably don't have that disease. So sometimes the solution is to come up with more information, but sometimes it's to understand that people don't like the solution. For example, in our context, I would bet that the people who hate needles or afraid of needles are denying the vaccination, not because of the vaccination, but because they don't like needles. And because they're afraid of needles, they are denying the solution. So one approach is to say, what information is people missing? And of course, there are people who miss information, and we need to fill that gap. But I think there are other people that it's not about information missing, is they don't like the solution. They don't like putting their kids with injection. They don't like injections for themselves. They don't like going to hospital, whatever it is. And if that's the approach, we need to think about it very differently.
Sure, that makes sense. And Professor Vasudevan, I'd like to come back to you because we've got another question that kind of addresses this gap in scientific knowledge that you mentioned that gets filled with misinformation. Obviously, as this vaccine gets rolled out, we won't know how long the immunity lasts after being vaccinated. So what can we do to address concerns among people that say, well, it's not worth me getting vaccinated because the immunity won't last very long? When we don't have the knowledge, how can we help address that concern?
Yeah, I think that's a great question, and that is definitely a concern that we've heard a lot in the news and seen, not just with this vaccine, but with some of the other vaccines, and the one that comes to mind is the flu vaccine. That's one that gets attacked all the time for its low efficacy, the fact that you have to get it every year. But look, with the number of deaths that we have had, 3,000, over 3,000 yesterday, the number of cases that we are seeing, we are breaking records every day. Even a vaccine that offers short-term benefits, it is worth it. And I think that's something we need to communicate. And if it turns out that, the immunity is just going to last for a year, we need to revaccinate, we'll figure out a way to do that. Right now, our ability to distribute vaccines is limited by the limited availability of the vaccines. We have, a certain number of doses that are available. More doses will become available over time. But the thing to remember that there are also other vaccine candidates that are being tested. And among them is one that requires only a single shot. You don't need 2 doses. So there are options that can, make up for the fact that we may need more frequent immunizations. And I think Professor Denny might have said this in last week's media briefing, that it may turn out we may combine flu and COVID vaccination campaigns on an annual basis. And so there's ways to approach that if something needs to be done long term. But I would say that's not something we should really be worrying about right now. I think the goal is to really stop this pandemic, like get it down to a place where we can control it. And even a vaccine that offers short-term benefits is worth it.
Sure, absolutely. Professor Bennett, I'd like to come back to you. Both these last 2 questions have addressed this idea of uncertainty, and there are gaps in knowledge, and that's where misinformation creeps in. How can leaders, who they want to be seen as kind of all-knowing and they've got their handle on things, how can they address this area of uncertainty? Is it best to be upfront about it? How do you kind of prevent misinformation filling in gaps as a leader?
Well, yeah, the first thing is certainly not to try to be all-knowing. That generally is
right.
Fails. I'd say that yeah. So I think this is a critical challenge for most organizations at most times. It's particularly true right now, obviously. And I think that there are a couple thoughts. One is frequent communication is absolutely critical, and the nature of that communication is critically important. So communication from leaders to others that is authentic, that is transparent as possible, that demonstrates empathy and knowledge, as we've discussed, of the people affected. It's really important. One way of countering uncertainty is to provide certainty about things is to provide certainty where certainty can be provided. And so, for example, communicating what we know on a relatively expected and sort of predefined timeline can be very important. Being able to provide information in ways that people expect to see. So, just as one example, here at Duke, we committed to a notification schedule for our students. We knew that with respect to any kinds of changes that may be happening in the environment, with respect to updating them about the nature of COVID in the environment, the number of tests and those kinds of things, we committed to that schedule. It looked the same every time they received it. We varied our message to some degree, and we committed to tell them the good and the bad. And we did it leading with gratitude and consistently demonstrating some semblance of empathy. And I think the challenge for leaders in environments like these, in moments of uncertainty, is that trust is in short supply in our society in a very general sense, and yet the sort of return on the investment of frequent communication is only realized at some point far in the future. So leaders have to commit to this and to do it with some frequency, some consistency, and authenticity, and be prepared that the returns themselves may not be evident for some period of time.
Thank you very much, and thank you for calling me.
Can I just add one thing to that really quickly? And I think that's a really important point, in that trust cannot be earned overnight. It really takes, long-term effort, building relationships to build trust. In fact, in August, I wrote an op-ed talking about the need to start engaging in that transparent, open dialogue and proactively working to build trust in communities that are being worst affected by COVID-19. And at this point, it already feels like we are playing catch up, and we have been playing catch up for a while in the Department of Public Trust and Vaccines. As I mentioned, we had 200,000 deaths due to measles last year, and vaccine hesitancy has just been growing over the last decade. And there hasn't been significant investment in addressing this issue. We all talk about what public health agencies should be doing, but public health agencies need funding, they need resources, they need support to be able to implement programs that can curb vaccine hesitancy. And so this all comes down to what national priorities we set, how we prioritize research, not just local research, but global research. And you can say that, some of the effects that we are seeing from COVID-19 are a failure really to invest in global health research. And so that's something to consider moving forward.
Sure, absolutely. And thank you for Professor Bennett for calling me on mentioning leaders as all-knowing. They're certainly not omniscient. Well, the words I was reaching for was well-informed. Anyway, we've got some more raised hands here in the chat. So we're going to move on now. Nicole O'Hara, you should be unmuted. Please go ahead and ask a question.
Hi there. This is really for anyone who wants to answer, but I know a lot of people have kind of told me when I'm out in the field, I kind of ask people, are they planning on getting the vaccine? And, a lot of times their response is that, oh, they did this way too fast. Other vaccines, are in the works for much longer of a time. What is your response to those people that feel that way?
It's a particular challenge, right? And you forgive people. I mean, people's expectations have been set by the last several decades of hearing about science on the evening news, and it's usually the finding of the amazing study is usually ended with them saying, and it'll be somewhere between 5 or 10 years before we see this result in a drug, right? And so you would forgive most of the American public when we have discovered a drug. We've gone from the bliss of a year ago to having a vaccine in a year. It only makes sense that people would imagine that there's something wrong with the speed of that timeline. And so I do think that there's a variety of strategies that we might use to counter message that. Fact is that we've known how to create these vaccines for quite a long time, and that the US government invested a ton of money in providing readiness for us to be able to stand up vaccines like this in a relatively short time horizon. This was something that had been architected over an extended period of time. That's the truth of it. I think messaging that kind of thing now is unlikely to be heard in the way that we would hope it to. But I think we need to find opportunities to try to counter this misperception wherever we can. The other thing I would say is that my concern is that because in the politically fraught environment in which we live, it's been impossible to describe the response, the sort of public-private partnership that has resulted in these vaccines. It's been too challenging, I think, for us to describe it in the way that we should, which is that it's on the order of the kind of public works projects of that we saw in World War II, right? It's on the order of the kinds of vaccine development and implementation projects that we've seen really fundamentally change global health in low-income countries over the last couple of years, right? I mean, it's a fairly amazing undertaking. And it's been challenging to describe it and to kind of get that kind of public excitement about it, given the politically fraught nature of our environment. I hope that changes in the next couple of months.
Yeah, I would add two things. So actually, I would elaborate on one and add one. So first of all, what Gary is saying, there's a story that a woman see Pablo Picasso in the park, and she said, "Would you draw me?" And he looks at her and he does this, and he gives her a drawing 30 seconds later, and she said, "That's unbelievable! What the resemblance How much do I owe you? And he says, $500. And she says, what, $500 for 30 seconds? He said, no, it's 30 years and 30 seconds. And I think that's one of that's what Gary is basically saying, is that people think of it as a year. It's not a year. There's been an ongoing effort for a very long time. So that's one thing that we need to express. And then the second one, I can't remember a time when so many people worked on the same problem, right? So we look at the time, but if you, instead of looking at the time, you look at the breadth, how many people have been working on this, it accumulates to much, much more time. So I think we need, by the way, I think science has done not a good job of promoting science. I think we should have had a really celebration of all the people who are working so hard for such a long time to try and find solutions. It's been a kind of a great history of basically people working unbelievably hard, pulling all the ingenuity, creativity, everything to try and figure this out. So it's not true to think of it as a year, because it's a breadth of effort, and it's extra time, and we need to communicate this to the people who are, for everybody. And we also need to celebrate science. We really need to celebrate this. We have a lot of progress. It's just wonderful.
Sure, thank you, all three of you, for that. Professor Bennett, did you have something to add?
Yeah, thank you. You would think that after 9 months of doing this, I would know how to unmute myself. I was just going to add just a piece there, just to Dan's point, which is that this is a moment for those of you who are looking for stories. One of the stories I hope you tell will be the stories of the lab scientists who have literally not left the bench this entire time. And one of the most remarkable things for me is that there's this perception that places like Duke closed down. It is true that our students went to remote course delivery, back in March, but we've had scientists at the bench for the duration. When things were really at the earliest stages and unclear and uncertain, and we weren't sure if it was airborne or what the mortality rate was, we literally had people sitting at benches trying to find solutions. And that ranged from folks who were new in their career to folks who were really senior, and it was happening all over the country. There's a partnership that's something I'd never imagined seeing in the world of the sort of hyper-competitive world of science. So I hope that story will be something that you all would choose to talk more about.
Sure, thank you all for that. We have another raised hand in the chat. Brian Murphy, you're now unmuted, so please go ahead and ask your question.
Thank you. I appreciate you guys doing this. Many of you have mentioned the politically fraught sort of environment that we're in. I think of something as Governor Cooper trying to navigate both those who think we need more draconian measures to keep everybody home, and those who think we need no measures at all. Given the uniqueness of the American system and the polarization, how do leaders sort of build that consensus when there are people on either side screaming just as loud?
So if I can try, I think with all of the differences in the US, there is general acceptance that democracy is acceptable. And in democracy, you basically accept the vote of majority. And even if you're a minority, you still accept it. Most people do, vast majority. And I think that's what we need to do. I think, if it was me, I would basically say, here we are in North Carolina, and we have two paths. We have a path of adherence to the following things, and we have a path of letting it run wild and think about the consequences, but not hurting schools and not hurting economics. Let's put it up for a vote. But it's going to mean that that's what we're going to do. And I think that the American psyche and our love for democracy could actually make something like that work. But it means that there's a vote. It doesn't come from top down, and the community gets to decide and get to live with the consequences of that.
Yeah, and if I can just add to that, I think it also matters where the message is coming from and the consistency of the message. So if what the states are saying is consistently contradicted by other levels of government, I think that poses a challenge. So I think focusing on the consistency of the message top down is going to be another important thing.
Yeah, I don't I wouldn't want to be in the governor's seat right now, given the challenges that you're facing, particularly given the nature of the environment. I guess the only thing I would add to this is to say, we had a moment where back in February, March, there's a pretty good chance that with the kind of national appeal that Dan's describing, that there's a chance that we could have significantly curtailed this pandemic. And then there are some arguments that say that President Trump is one of the few people who probably could have gotten it done in some respects, because he could have spoken to a group of people who are particularly disaffected and less historically likely to attend to government messages. I think that we have another chance coming now with the vaccine. And it's the kind of thing that should be unifying to some degree, really across this sort of politically fraught divide that we have right now. I mean, again, if I point to places in the eastern part of this state and the more rural parts of North Carolina, there are real concerns about the decline in economic productivity, particularly in smaller communities that had been experiencing a bit of an upswing in recent years. There was a real concern down at the coast about the changing nature of tourism in the mountains, about that rate. There are good reasons that are not explicitly health related that politicians should be able to get aligned around this next moment, which is how do we maximize the ability to vaccinate as many North Carolinians or as many Americans as we can. But it's going to require really deft leadership that is not focused exclusively on hogging the mic at all times, but really working closely with local leaders to try to understand the particular needs in those respective communities and building political alliances that will allow for messaging that may look a little bit different in the rollout, but ultimately is aligned with getting folks vaccinated.
Okay, thank you all for that. Brian, I hope that answered your question. Certainly a very important one with such a crucial year about to begin. We're almost at time here. So I've got one final question that came in that I'm going to address to all three of you in a slightly different way. We've talked a lot about what matters at leadership, but of course we're all having personal conversations with people. And we had a question that kind of touches on that level. So Professor 𝐓𝐡𝐞, I'd like to start with you. And the question is, if you're having a dinner, a distance dinner, let's hope, with somebody who's like, you know what, I'm on the fence about getting vaccinated. If you just had a couple of minutes to talk to that person in an empathetic way, or how would you go about using what time you had to convince them that getting vaccinated against COVID-19 would be a good thing?
That's a great question. First of all, I'm not having dinners with anybody. I'm socially distancing, so that's important to note. But if I were at dinner with somebody, I would actually try to understand what their position on vaccines are and what their concerns are, and try to respond to that directly.
Sure, that makes sense. Professor Ariely, let's say you're on the phone with a relative who is resistant to the idea of masks and distancing, doesn't think it's going to help, or thinks the whole thing's a hoax. You had a couple of minutes to talk to them. What might you say?
So I would say that I think there's no chance that they will regret it. But if they don't take it, and they are either going to get sick or get other people sick, they could regret it. And what I would ask them to do is to imagine how they would feel if they passed COVID-19 to somebody else. And I would just say, just try to imagine how that would feel like. And now tell me that you shouldn't do a lot to prevent that terrible feeling of regret that you didn't take the vaccination earlier.
Thank you very much. And Professor Bennett, let's say you're talking to a student or somebody else that doesn't see the point in any of this, and you're trying to convince them to do the right thing. What might you say?
This is a conversation I've had many times in the last 6 months. And, I do a variation on what Dan suggested, which is I usually ask people to think about, get 3 people in your mind who are, over age 60, people that you care about, not necessarily family members, but people you encounter in your life, and people that you just have a care for. Is it a dining worker? Is it a bus driver? Is it, a landscaper? Is it your grandmother? Now imagine that you have the ability to keep them from getting this disease. Help me understand why you wouldn't choose to do the right thing in those kinds of scenarios. And so again, I think for me, this is about, again, the communal impact and helping people to understand even if you're in a really low risk group, and many of our students are in a very low risk group, that the decisions they make are decisions that have potentially significant impacts on folks they care about in this community.
Absolutely. Thank you for that. And I can't think of a better place to leave it. Thank you, everyone, for joining us. Thanks to our panelists, Dan Ariely, Gary Bennett, Lavanya Vasudevan, for sharing your perspectives. We are continuing to hold regular briefings, and we'll be touching on the vaccine rollout and, of course, the ongoing efforts to battle the pandemic. If you have an interest in being on our list for future briefings, please email me at gregory.phillips with 2 L's at duke.edu. In the meantime, please stay well and have a safe and happy holiday that involves staying at home and being distanced. Thank you very much and have a great day.